You're watching CW Montana. This is the MTN 9 o'clock news.
Good evening. Thanks for starting your week with us. I'm Russ Riesinger. More information coming out tonight about two murders that happened late last week here in Yellowstone County. Prosecutors say that 34-year-old Jennifer McCollum was brutally beaten and stabbed to death by a jealous ex-boyfriend with her children in the home at the time. Deputies responded to Arrow Creek Trailer Court in Ballentine early Friday morning to find McCollum lying dead in a pool of blood, her three young children peering out the window of the trailer. McCollum had stab wounds to her neck, face, and wrists, and had also been beaten. 37-year-old Stephen Phillips is now charged with deliberate homicide in McCollum's death. Prosecutors say Phillips lives in the same trailer court, and the two had recently broken up. Witnesses told deputies he'd been threatening the woman in recent days. And a 33-year-old man shot and killed just a few hours earlier has also been identified now. Yellowstone County Coroner Cliff Mahoney says Kenneth Cobb died of a single gunshot wound to the chest. Happened around 3 a.m. at a home on 429 19th Street West. 62-year-old Robert Knight was booked into the Yellowstone County Jail this morning and faces a charge of deliberate homicide. According to court documents, Knight told police that Cobb and Cobb's girlfriend would not stop arguing and that he shot Cobb after he refused to leave the home. Well, it's a rite of passage as gates to Yellowstone National Park open for tourists today. Vehicles lined up from around Wyoming and across the country to get the first look at spring in the nation's oldest park. But entrances in Montana remain closed for now. Q2's Jay Cohn and chief photographer Paul Humphrey made that trip today to see if the park, even half open, still pulls in the people.
Cody, Wyoming bills itself as the gateway to Yellowstone Park, and it was never more true than today, as the east entrance about 70 miles up the road became the first Yellowstone entrance to open for the season. A steady stream of cars and campers making their way through the east entrance that opened at 10 a.m. this morning. Yes, the lure of Yellowstone still strong, maybe even more so in this pandemic, as people seek a little peace of mind in the great outdoors. If you are planning a trip to Yellowstone, though, come prepared. The park has modified its visitor services to prevent the spread of COVID-19. The park asking people to wear masks in high visitation areas, and there's a limit on the number of people allowed in the visitor centers that are open. We'll have much more for you tonight at 10 o'clock. For now, Jay Cohn reporting for MTN News in Yellowstone National Park.
And Jay tells us even in a pandemic, Yellowstone is a great place to spot license plates. He says he saw visitors from New Jersey, Pennsylvania, Illinois, even Texas. Well, in Montana, many are wondering when the three gates here will open for the season. As of now, Governor Bullock has not set a date for that to happen yet. But as MTN's John Shear reports, some business owners want that to change sooner rather than later.
What's keeping the Montana gates to Yellowstone closed is the state's 14-day quarantine requirement for out-of-state visitors. Governor Steve Bullock insists it's working.
We have the lowest hospitalizations and cases per population in the nation.
So Bullock says he's unlikely to lift the quarantine until at least the 1st of June. Business owners say he should reconsider.
We need to get open. We need to, the virus is a terrible thing, but we have to deal with it, and we just can't have the whole country go bankrupt.
That Montana should take a closer look at what guidelines we have so that our businesses can get back to somewhat normal.
We need to figure out how we're going to deal with the new normal, because if you wait too long, we can't exist.
Park Superintendent Cam Shawley admits it's a tough decision.
We're doing the best job that we can to reconcile divergent opinions on these issues with our partners.
Shawley said he hoped Montana and Wyoming could agree on an opening date, but Bullock wants assurances that the park will be ready for the crowds.
Including health screening protocols, a surveillance testing plan, the limiting of large gatherings and frequent cleaning and sanitation requirements.
If they use the best practices for mitigation and keeping themselves and others safe, we can move forward and there won't be any problems or minimal problems.
But there's one step Shawley says the park just won't take.
I will not put my staff at risk having them attempt to socially distance large crowds of visitors who decide not to adhere to social distancing guidance.
Business owners we spoke with agree that behavior of park visitors is the key to keeping it open. They say every business needs to impress that upon their guests. In Bozeman, John Shearer, MTN News.
The governor says another reason he's keeping the Montana gates closed is to give local health departments time to prepare for large numbers of tourists. Well, President Trump says he's taking a controversial drug to stop him from catching the coronavirus, despite FDA warnings not to. Natalie Brand is at the White House, where the president hosted several meetings to discuss the economy.
I'm taking it, hydroxychloroquine. Right now, yeah.
During a roundtable with restaurant executives, the president revealed he's been taking the drug hydroxychloroquine along with zinc for nearly 2 weeks to try and prevent the coronavirus.
It's been around for 40 years for malaria, for lupus, for other things. I take it. Frontline workers take it. A lot of doctors take it.
The FDA has said hydroxychloroquine should only be used for COVID-19 by patients being monitored in a hospital. The president says he consulted the White House physician before taking it.
No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it.
The president also criticized China and the World Health Organization as it kicked off the World Health Assembly.
The United States pays them $450 million a year. China pays them $38 million a year. And they're a puppet of China.
The president held meetings throughout the day with his advisors, restaurant executives, and state governors, all with one big topic on his mind: reopening the economy.
Not only are the markets up tremendously, but we've had tremendously good and positive information on therapeutics, on cures, and on vaccines.
Stocks rose Monday morning with news the drug manufacturer Moderna Therapeutics posted promising results in phase 1 of its COVID-19 vaccine trial. The FDA has given the go-ahead for the company to move to phase 2 of its study. Early participants developed antibodies after receiving 2 doses of the trial vaccine.
Our goal is to have a vaccine available for broad distribution by year-end or early next year.
Meanwhile, the House passed a $3 trillion stimulus package late Friday, but for now, Senate Republican leaders and the White House have continued to say they're in wait-and-see mode. Natalie Brand, CBS News, the White House.
Well, the FDA says it's reviewing the safety of hydroxychloroquine in patients for whom the use was authorized, but warns it has not been shown to be safe and effective for treating or preventing COVID-19. Here in Montana, 2 more people tested positive on Sunday, one in Ravalli, the other here in Yellowstone County. Those positives bring the state's current reported number to 20 active cases, 434 recovered, and just 4 remain hospitalized. Meanwhile, Wyoming health officials are now reporting 10 COVID-19 related deaths. The state stands at 577 total COVID cases, 504 have recovered. The Montana VA healthcare system is starting to re-implement many in-person services that had been suspended. Montana was selected as a lead site in its regional Veterans Integrated Service Network. They're using a phased approach to reintroduce healthcare services, including laboratory, pathology, pharmacy, and radiology services. Elective procedures and dental will continue in the coming weeks. The Montana VA will keep screening for COVID-19 and require patients to wear face masks in facilities. The VA will also use telehealth, which they say has been invaluable over the past 2 months. The Montana VA urges veterans to reach out if they're experiencing any kind of medical issue and to not avoid getting treatment. Well, doctors and nurses from across Montana have answered the call for help as New York hospitals became overwhelmed with COVID-19 patients. Some of them flew there to help save lives, while others stayed right here and found themselves on the front lines thousands of miles away. MTN's Jill Valley has the story.
There's a bank of computer screens at Missoula's St. Patrick Hospital where doctors use telemedicine to offer their expertise to doctors around the country virtually. And as New York became overwhelmed with COVID-19 patients, doctors here knew they could help.
I think they were doing a fantastic job with the resources they have, but taking care of complicated ICU patients with multiple organ systems that are failing is nuanced care and requires a lot of specialty training. So they were avid for whatever whatever advice and guidance we could give them.
As an anesthesiologist and critical care physician, Dr. William Serber and others guided New York doctors in the battle of COVID-19, as some of those doctors didn't have that specific expertise.
I remember rounding with somebody who was an orthopedic surgeon who had stepped up and is actually managing an ICU patient. And these are complicated patients. These are difficult to manage in all the best scenarios.
Through the wonders of technology, doctors here could look over the exhausted shoulders of doctors there, offering their expertise, a second set of eyes, and even reassurance they were doing what's best for their sick patients.
With a camera, cameras and microphones and computers, I was on their electronic medical record so that I could see all the data on each patient. We would go around to every single patient and discuss all the aspects of their care.
Dr. Serber and the other physicians were able to treat these COVID patients without being exposed to the virus themselves. But what they were exposed to was the kind of experience that will come in handy if COVID-19 flares up here.
This gave me and the other Missoula physicians who were doing this infinitely more experience at managing these patients firsthand. So I think that if we do end up seeing a higher volume of COVID-19 patients in Missoula, it makes us better positioned to take really good care of them here.
With a more manageable patient load in New York for now, Dr. Serber and others are able to take a break from those virtual overnight shifts in New York, but they're always ready to step back in. Still to come on the MTN 9 o'clock news, one of the most heated political battles here in Montana will be for the open governor's seat. We'll break down the Republican candidates in just a bit, but first, Bob McGuire's in with your full week's forecast.